Okay, so we'll start with today's session. The first case will be AFRS because this was a question which had lots of confusion with the group. So we'll discuss that. After the AFRS session, I'll be the remaining 55 to 60 minutes will be a revision oblique repetition of the classes which were held on 3rd December and 6th of December, right? And after this, I'll be sharing. After this, I'll be sharing this PDF and recordings of the same. So this will basically be a revision for the previous session people. In case you don't want to go to the revision session, आप अपना कुछ और revise करना है, you can revise that, not an issue. Okay, and for the new guys, please go through this. This is important. And since I'll be covering 2 classes in one type, so I'll not go into much details because details are not required for your DNB exam. Okay, what is required, I'll just brief you through. Okay, so let's start with today's session. And guys, this again it will be a interactive form of thing. Okay, it's not like one way वो lecture वाला कहानी नहीं है कि slides we keep on changing and everybody sleeps off. It's basically for the exam purpose. So from both sides interaction should be there, right? This was the this is the question of this last session which was held for DNB last batch. A 30-year-old man presented with complaints of unilateral nasal obstruction, sneezing and coryza. On examination, blah blah blah, and sent for biopsy. Now what they are saying, serum galactomannan test is negative. Okay, this is what information they have given, and they have given images of one is of this HNE examination, and second is your GNC examination. Now they are asking you what is the diagnosis. Okay, now there was lots of confusion, and in spite of asking ki DD try karo, nobody even attempted the DD also. So my whole idea, like, about this thing is you should not jump to AFRS. Answer is AFRS है, ठीक है? You should not jump to AFRS है, but how you can reach at least till 2-3 points, how you can narrow down your things. Okay, so just I'll take a minute of yours. What else if a person is coming to us with unilateral nasal obstruction? So what can be the DD of that guy? Can somebody take a try? क्या क्या हो सकता है यूनिलैटरल नेजल ऑब्स्ट्रक्शन का डीडी? दिस कैन बी अ वेरी वेल अ शॉर्ट वाइवा ऑब्लिक टेबल वाइवा शॉर्ट केस हो सकता है इस पे, है ना, नेजल ऑब्स्ट्रक्शन पे. This is just OSCE will take 10 minutes and discuss this thing. Okay, can somebody unmute and just we'll try for DD for unilateral nasal obstruction?
AC polyp. So is
AC polyp. Okay.
Inverted polyp.
Great. एक क्या हो गया? Great. So first is AC polyp. Then what was the second? Inverted papilloma. Okay. Then after this, anything else is coming into your mind? ठीक है. AC polyp की variety में you can place your AFRS. Some sort of malignancy can also be there. Yeah, this can be answered better as tumor which can be malignant oblique benign. Okay, so and CRS with nasal polyp. Okay, this can be the mota features. Now, the second line which they are giving to us is that the galactomannan test is negative. Okay, so galactomannan जो test होता है, this is aspergillus में negative होता है. Aspergillus में galactomannan होता है. Basically, this is what you should know. कि when we send the sample for biopsy, if it is a fungal culture which contains aspergillus, so galactomannan will be positive in this. So what they are trying to tell us, yeah, this is not aspergillus. Okay, it can be anything, but aspergillus नहीं है. So diagnosis में, what I'll just repeat, कि there is nothing for the tumors part. They are not giving you any history which is pertaining to tumors. This you can rule out. There is no history which is pertaining to bleeding and bleeding on touch, all those things. So you can rule out your IP. Okay. Then goes for your AC polyp or CRS with nasal polyp. This can be an option, but you have to. I always say कि अगर आपको, if you don't know the exact answer, go through the options also. Okay, go through the options also. This will also give you a clue what can be the answer. I'll just answer it. See, what is the diagnosis? Answer is AFRS. Okay. Now, might be you are not knowing what are the 2 organisms for it. Okay, ठीक है. What is a stain for it? You might not be knowing it. Now, अभी इतना सबका वाइवा हुआ है. We all know that there are characteristic radiological findings in which disease of nose. This is AFRS, right? We see the double density sign. We see the deposition of these metallic things inside the Name the diagnostic criteria. We only remember Benton-Kunz criteria. Don't we remember? So where it is used? It is used in your AFRS. So that's how also you can get back to the what is the correct answer. Okay. So and apart from that, what all species can cause this AFRS? These are mainly three. This is
Alternaria, bipolaris.
Yes, you can remember it as A, B, C. So A is for your alternaria. Okay. B is for your bipolaris. And C is for your curvilineria. Spelling एक बार देख लेना. I don't think ठीक ही लिखा है. ठीक है. So this you can remember. And what is the stain for this AFRS? Take a try.
GMS pass.
GMS. ठीक है. GMS you can answer very nicely. GMS is our answer. Okay. And बाकी I've shared this PDF of this AFRS collect जो एक short PDF है 3 pages का. Just go through that. Okay. It contains all the detail and जो इसका वो IJOC PATH का जो जर्नल एक शेयर किया हुआ 3 पेजेस का उसमें this is the exact image which they have taken from. Initially I was doubtful कि इन्होंने स्काउट ड्रोन से दिया हुआ है. I was going through Scott since yesterday जब से आपके डॉक्टर शुभ कल्याण ने ये क्वेश्चन पूछा था. But I was not able to find the exact image in Scott drone. But luckily in this journal I got it. So I've shared with you. Just go through it once. Okay. So guys, इसके साथ जो associated questions है, I'll just take a minute of yours and just will try to tell you. In inverted papilloma, please remember multiple names of inverted papilloma. This is a question, okay? Write it in red. Multiple names of inverted papilloma. Okay, there are multiple theories of inverted papilloma. Please go through it. There are certain classification HPE का जो है crowd staging वगैरह है वो इससे आता है आपका inverted papilloma से. So please go through it. It is an important question. One. Second thing, AFRS and base of skull. Short question. You will get it definitely in some form or the other. So AFRS you cannot miss it. As soon as you start your analogy, please go through all the ABCD of AFRS. Like I keep on saying COMs, सब कुछ आना चाहिए. वैसे AFRS is one question where you should know everything about it. Whether to read the CT of this AFRS, how to manage it, what are the stains, what are the organisms, XYZ, anything, you should be ready with this question. इसमें कहीं से कोई scope नहीं होता है. Same goes for your base of skull. Okay, so all the foramens, है ना, you should be thorough with your foramens कि what forms कौन सी bone से बनता है, what structures pass through that, what syndromes are associated with it, and all the surrounding things. Still guys, I'll say it's almost one for you. Okay, so even if there are multiple people who have not yet started, okay, so still you have the time. Please don't fall into the trap that I don't know anything, अब नहीं हो पाएगा. ठीक है. People who have started right back from November and definitely you have an advantage, but please continue your momentum. This is the time when you should switch on your gears. Okay, but please push on yourself. So let's start with today's session. Okay. I'm not able to join your meeting. Why? Just a minute. Somebody is trying to join. Please log in. Just half a minute, guys. Somebody wants to join. Anyone else? Okay. Great. So let's start with our today's session. Okay. So guys, so AFRS, please complete it completely. Okay, you cannot miss anything about the AFRS section. So moving ahead, I'll just brief you for a minute about how your examination is generally going to be held. I've shared the PDF also that was issued by NB. See, you will be having 20 OSCEs. Okay, 20 OSCEs will be there of 5 marks each. This results to 100 marks. The main hurdle for this is the time limit. Okay? There is a clock which is running on the right corner which goes backwards. Okay, so that is the place where you create, where all the confusion is created and you are under pressure. So you get 4 minutes for one question. And the point is कि there are 20 sheets will be given to you like this. हर किसी पे you have to write your name, roll number type से and question number. And once you complete your question number 1, the examiner will take that sheet. So that we have that habit कि इसको छोड़ देते हैं बाद में लिखेंगे. This is not going to work over here. Then whatever you know, you have to fill it in that particular time, 4 minutes that you have. Completion of 4 minutes, they'll just come, snatch your sheet and go away. Okay? So just whatever you want to write, please write it. And my advice is don't leave anything empty. Don't leave anything. Example above. कि अगर सपोज ये देखो AFRS का क्वेश्चन है 1 2 3 4 5 एक नंबर एक नंबर एक नंबर एक नंबर you write AFRS over here, you get 1 marks. You write 2 organisms, you get 1 marks. But supposedly you waste a lot of time over here only and आपको ये तीनों क्वेश्चन नहीं कर पाते हो तो आपको सिर्फ 2 out of 5 मिलेगा. Getting my point? So it's not a wise thing कि आप you spend lots of time on one subset of question and last के 2-3 points you are not attempting only. That is a foolish thing. Attempt everything. There's no negative marks. After this, what's going to happen is there's going to be a long case. There's going to be a long case which is basically of 100 marks. Then remaining 100 mein generally what happens is they divide into 40 and 60. This is what is given in your NBE का ये. This can be word round. इसमें आपके 10 into 4 मतलब 10-10 मार्क्स के 4 केसेस रख देते हैं whatever is there in there and 60 marks का viva was करके दिया है. This can either be a short case or it can be a like table viva sort of something. Okay, so this results to your 300 marks and for passing you need at least 150 marks. Okay, previously what used to happen was before 2016 you had to pass independently in OSCEs मतलब 50 out of 100 यहाँ आना चाहिए और यहाँ पे 100 out of 200 आना चाहिए. So then you were passing. But now after 2000 I think COVID के बाद से they had changed it. Combinedly you have to pass. So you should be aiming full on this long case. 100 marks का जो है. This is 90% of the people. It should be CM's commerce only. Okay. So this is a place where if you answer averagely also, I'm not saying you have to answer extraordinarily. If you answer as an average student, you will be getting 50 to 60 marks. Even if you don't dig your own grave. Okay, so this 10 marks का जो क्वेश्चन आपका यहाँ पे आपको मिलेगा, you can have this over here. मतलब if you are very unlucky that you are getting less marks in OSCE 35-40 तक भी आ रहा है, so this will pull you. This 60 marks will be pulling you towards your 50% grace marks. Getting my point? So please read everything about CM's commerce. Don't leave anything about it. Okay, please do attend the class on CM's commerce का revision है. What else? What videos we have shared? Please go through it. वो viva के जो 20 pages हैं, please you have to just learn it, digest it, ratify it. Please remember it. Okay, मतलब that will sail you through 50% marks. Okay, उसके बाद everybody has his own caliber, has his own potential. Okay, चलो, let's start with today's session. ठीक है guys, see the image given below and answer the following question. What is this fluence threshold, what is laser safety, and name 2 uses of laser in ENT. So I'll just answer it for you. The image is for your laser. Okay, what is fluence threshold? I'll answer it again for you. It's basically that lowest energy level at which the tissue starts to vaporize. Okay, now laser safety we all know. Okay, there's no fun in telling. We all remember those laser safety protocol कि OT के बाहर जहाँ पे चल रहा है, there will be a board stating that laser surgery is going on, room should be dark, people should be using goggles. Okay, that laser safety tube should be there, fire extinguisher should be there, and that area should be covered with wet gauze piece and all that you have to answer. Okay, now what are the 2 uses of laser in ENT? You can you know very well. You can answer that stapes surgery, laryngeal surgery, XYZ, whatever you want to answer, please answer it. Okay, now coming to image of this gentleman, can somebody answer? Take a try. Why is he famous? He looks like an Indian guy. Okay, so Indians are famous in only few places. Now I'll answer for it. C. Kumar N. Patel. Thank you, Dr. Sneha. And what did he do? Why is he famous?
Carbonate.
कार्बन डाइऑक्साइड लेजर. ओके, सो इंडियंस का कहीं कहीं पे मतलब लाइक नॉर्मली वी लुक टू द वेस्ट, बट देयर आर सम प्लेसेस जहां पे लाइक वी lead it. Okay, so CO2 laser, one of them. Second, your hypopharyngeal malignancy. Okay, Dr. Rishikesh Pai is a Indian doctor who has edited it, and he's the author of that chapter of your Scott Brown. That's why it's important. ठीक है, in our GNA things है ना, GNA में अपने इंडिया का बहुत like people have done massive work. So these things are places where we are ahead of West. Okay, CO2 laser का wavelength you have to remember. Coming to the topic per se, I have a habit of deviating. CO2 laser में you should remember this is 10,600 nanometer. Now 2 more things for you guys till you pass your practical. Please remember the units. ठीक है, if you write 10,600 आगे छोड़ देगा तो DNB will cut the number. So please note the unit. Then no short form. ठीक है, you should not use any short form until you pass your exam. 2. Number 3, when you see any image of any drug, just see the date of expiry. If the date of expiry is given, like दिख रहा है it has expired, and they're asking how will you give it to the patient, just tell कि sir we cannot give it to the patient because the drug is expired. 4th, any question related to counseling or any question related to patient interaction or during your viva, long case oblique short case, please remember whatsoever your nature may be, howsoever you may be taught in your institution, please don't forget to wish the patient, introduce yourself, namaste, I am Dr. so and so, मैं आपको एग्जामिन करना चाहता हूँ XYZ, take his consent, okay, explain what you're gonna do, and after you finish your procedure, say thank you. These 5 points are very important. Please don't forget. Many a times there are OSCE stations में they'll give you counsel a patient regarding thyroidectomy. You have a patient of T4N1 M0 of CA larynx, counsel him for total laryngectomy. Okay, so you have to say these points. If you will not say, you are gonna lose on marks. Okay, so moving ahead, this is the laser safety tube. Kindly note the double cuffs which are there. This is the paragraph on laser safety by Scott Brown. They might even ask the principles of laser safety as a question. So just go through it. I know lasers is more of a theoretical question, but from the practical point of view, these 4-5 things are important. Okay, there are multiple name tubes over here. This is the Norton's tube. This is the Mallinckrodt tube. 2. Please see this again. I'm saying see this double cuff. Okay, and now this is the normal ET tube. Here what you should remember is this thing is called as Murphy's eye over here, and we have a radio opaque line over here, right? Okay, again this tube is called as Bivona foam tube. Okay, there are few more symbols which are important to you. This is for biohazard. This is symbol number 2. This is your radiation hazard, symbol number 3. Cytotoxic, symbol number 4. Laser we have already seen. So mota 4 symbols are there which are important for you. Okay, now coming to this question I have seen at least 2 times. अभी इस बार भी ये पूछा हुआ था, ठीक है, in a little different format. So just repeat it for you. 45-year-old male patient came to OPD with complaints of impaired hearing in right ear. Listening is own full fall. Now they are telling you whether you know how to eat CT or not. See, sorry, as soon as we see a picture of the CT scan, right, so we just try focusing on finding the image on CT ki isme kya hai, I'll just find it out every time. No, just go through the theory once. There is a possibility they'll give you a hint also. Now over here they are giving you a hint that this is a SCCD, superior semicircular canal dehiscence syndrome. Now this image is from Scott Brown. ठीक है, now today evening please revise this chapter of Scott Brown, superior semicircular canal dehiscence syndrome. You will see this image. Now what is the gold standard investigation for this case? Can somebody take a try? ठीक है, confusion कहाँ होता है? Some people like to write vamp over here. Vamp is not the gold standard. Okay, what type of hearing loss is seen? This is CHL. Vestibular function कौन सा होता है? Vamp. Please go through both the vamp, O-vamp, C-vamp. This is important for you. Then there comes the full form of fiesta. Now, can somebody again unmute and take a try? 30 seconds. all sequences of MRI. ठीक है? Make a PDF and start learning it. This is one thing you cannot remember on the last day. If you think if fiesta, flare, cis, ठीक है, you will learn it on the last day. My dear, you will be mistaken, you will forget it. ठीक है, right now, it's 1 month. Start writing it out, start revising it. You are definitely gonna remember. Now take a try. Answer what is Fiesta?
Function imaging employing steady state acquisition.
Fast imaging, थोड़ा सा अंतर है.
Sorry.
Fast
Yeah.
imaging employing steady state acquisition. Okay, so please, this is a sincere humble request. Please इसको rectify it, है ना? इसको multiple revisions can only save you. Now enumerate 2 surgical approaches for its management. The name for the approach which Scott Brown mentions is Lorne-Parn technique. Whatever you want to answer, you can answer. And there are multiple thing associated with the round window, that is your plugging. You either plug it, you cap it, all those things you can do. Now from your otology section, please, during this week only, please go through. One will be superior semicircular canal dehiscence, second will be Meniere's disease, third will be otosclerosis, last will be SSNHL. These are those chapters which are very important for your OSCE's oblique practical session. I have not included COM over here. COM अपने आप में important है, ठीक है, उसको तो छोड़ना ही नहीं है. But for your theory, see, the thing is कि we think कि हम will read a whole chapter, whole book in one go. That is humanly not possible. Okay, that is humanly not possible. It's very easy for me to, from this side of the screen, to say कि हाँ पूरा Scott Brown याद कर लेना. This is not humanly possible, है ना? I speak whatever I could do as a resident. ठीक है, when I was a resident, I was like barely able to read one page also. Chapter also बहुत बड़ा चीज है. ठीक है, but coming to this side, I used to realize कि they are asking the very same things which are given, the same diagrams which are given over there. So this was thing I could find it out. At least from the otology section, please go through these 4 chapters. And after you complete them, please jump on your implant otology and उसके बाद jump करना. ठीक है, चलो moving ahead. This is the details which I have taken from Scott Brown itself. The above questions का answer is given over here. This is the same image which was asked in your DNB exam. Chalo, moving ahead. Again, an image from Scott Brown, and this question has been asked twice. Okay, this what is the most likely diagnosis? The diagnosis for you will be vestibular schwannoma. Okay, what is the sign which is seen on your MRI? This is called as ice cream cone sign. What is the contrast used? This is gadolinium. Stop using the habit of GD. ठीक है, पूरा नाम लिखना है. Okay, now what will be the resultant complication if SRS is attempted in tumors greater than 3 centimeters? तो पहली चीज है कि SRS के बारे में you have to read. ठीक है, what is the difference between SRS and SRT? The main difference I'll answer that SRS is a one-time treatment, surgery है, therapy. This can be divided into multiple applications. ठीक है? They are giving answer to one more OSCE question कि SRS is used till what size? The SRS is used to tumor till 3 centimeter of size. Now what they are asking is कि अगर 3 centimeter से ऊपर भी लगा दिया तो क्या होगा? Basically what can happen is कि it can result into hydrocephalus and some obstructive hydrocephalus हो सकता है. That is the maximum thing which can occur. Okay, so see, this is the image which they have taken. Okay, Scott Brown. Now second, this is somehow I feel important. ठीक है, I've been telling everybody to read. Till now I have not seen this as a question. This is one of the named curve called as Nelson-Allen curve, which is seen in your vestibular schwannoma. Okay, so this is important. Please remember it. I don't know. I have this gut feeling that this is important. Either it will come into your session or some next session. It will come. Okay. Apart from Nelson-Allen curve, there is one more curve which you should remember. The name of that curve is Kaplan-Meier curve. This I have seen as a question. This came in my exam, and after that also I have seen it at least 2-3 times. Okay. So both of them. Vestibular schwannoma is one chapter which you should eat, digest and assimilate. Okay. Now coming to the questions which can be asked. First, this we all remember. SRS SRT हो गया. Difference between cyber knife and gamma knife. Okay, तो cyber and gamma. Gamma में main चीज है कि there is a rigid framework which is there, which is applied. जबकि यहाँ पे ऐसा कुछ नहीं होता है. Here neck is not, there is no lesions of neck oblique spine treated, जबकि यहाँ पे treat कर सकते हैं. Now coming to this thing, this is again an important question. What is RION? Can somebody take a try?
Radiation induced optic neuropathy.
Yeah. Thank you, Dr. Sneha. Radiation induced optic neuropathy. Second question they'll ask you, what what is the dose after which RION can occur. This is if it is more than 8 gray radiation is given, so RION can occur. Now SRS जो होता है, normally SRS 12 to 13 grays is given radiation. Okay. Now what is pseudo progression? Pseudo progression में क्या होता है कि normally after giving the SRS there is some transient increase in the swelling which normalizes after some time. Now as soon as you complete your chapter on SRS, the next chapter will be NF2, which is very important. In NF2 you have to look for these things. What are these? These are bilateral CP angle tumor. Okay, so this is important. Now what else question can come? इसमें आपका screening protocol you have to remember. When do you screen the patient for NF2? One, second, you have to remember the treatment. Treatment में there is one drug by the name of bevacizumab. This is very important. Please make a list. Please make a PDF of drugs. ठीक है? This you have to revise for the last 48 hours. I keep on telling you guys, please make two things. One, these kind of PDFs. Second, please take out a page or WhatsApp yourself only the topics where you flutter. है ना? हर किसी को पता होता है. These are the 5 topics. These are the 10 topics. I always forget. Like for myself, I have no hesitancy. PFS and hypopharynx was the topic where I always forgot what is going to happen over here. Okay, so please make a list कि आपको क्या क्या नहीं आता है, whatever you want to revise, because last 48 hours, believe me, they'll be full of hectic timing. You have to travel to some new place, new hotel you have to check in, and that is the time when you are like, अब मेरा मन नहीं करा पढ़ने का, तो मैं क्या पढ़ूं, मुझे समझ में नहीं आ रहा, I'm not understanding what I'm gonna read. Okay, so that is the time when you have to revise all those things. So please start compiling that list of drug. Bevacizumab should be your drug number 1. Second drug, not related to this, but very important, cetuximab. Please read about it. Very important question. Chalo, moving ahead. So these are the images of your NF2. Okay, NF2 के अलावा you should remember the screening protocol. Okay, screening protocol starts at 10 years of age. 10 साल की एज में you start by screening by doing MRI, and again repeat it after 2 years if the patient is under 20 years of age, and 3 years if he is under 30 years of age. Yes, both of these things are given in your Scott Brown. Please go through it. It's very important. Now, देखो, वैसे जो मैं आपका नाम लिया and it's here. So it's very important. What is this mechanism of action? Take a try.
VEGF inhibitor.
VEGF inhibitor. ठीक है. So what I'll suggest is आज after So what I'll suggest is after completion of the class, Google पे डालना what are the VEGF inhibitor drugs. 4-5 drugs आएंगे, उसमें जो आपका ENT का drugs है, please ratify it. Okay, what are its uses in ENT? मोटा you should remember. First is your NF2, then you have juvenile onset respiratory papillomatosis, then you have your HHT. ठीक है? So these are the places of your ENT. Non-ENT पूछते हैं तो colon carcinoma and other carcinomas also it is also being tried. Now again, coming to one very important topic, that is your stapes surgery. Okay, photosclerosis is a very important topic for you. Sodium fluoride as a tablet is being asked. Multiple questions from stapes surgery, and these instruments, same instruments have been repeated 2 times. Okay, this is your skeeter. Okay, this is your perforator, and name of this is Larkin's hand burr. Larkin's hand burr. ठीक है. Now ये हो गया, instruments हो गया. Where they are used, they will be used for your stapedotomy or stapes surgery. Now no contact क्या use करेंगे? This will be laser. ठीक है. और ये क्या है? 4 intraoperative complications you can write very well. Okay, that your foot plate, floating foot plate है, injury to facial nerve है, CSF gusher है. This you should answer. Okay, now moving ahead, these devices are used for trismus. Please remember the gradings of trismus. This is called as threaded tapered screw. Okay, trismus को 3 भाग में बांटते हैं, mild, moderate, severe. Anyhow you can remember. Mild में the opening is 30 to 40 mm of interincisor distance. Moderate में 15 to 30 mm, and severe में less than 15 mm. Okay, this is the same thing. This is the same thing. Okay, now again these are 3 important sutures which are important for us. The name of this suture is known as sternomental suture or mock suture. ये आपका basically total laryngectomy के बाद करते हैं to keep the neck in the flexed position. Okay, now this is called as Tarabichi stitch, and it's named after this gentleman, Dr. Muaz Tarabichi. Please remember his name. Please go through the scientist's PDF. If somebody doesn't have it, please drop me a message again. I'll again share it with you. ठीक है? तो उसके अलावा this Moaz Tarabichi image is not given over here. This is extra. C. Kumar N. Patel is extra. Now coming to this thing, this is contact endoscopy. ठीक है? What else they can ask over here? I'll just let to you know. दो तीन चीजें. They'll ask you what is the uses, what are the principles. ठीक है? Second question is कि इसमें डाई कौन सा यूज करते हैं? They use methylene blue dye in contact endoscopy and it has 60x and 150x का magnification power as compared to a normal thing. Okay, now coming to one very important thing, what is field cancerization? I'll explain it in simple terms and then share a PDF with you. Please go through it. Field cancerization, it's basically ki when a person smokes, okay, when a person smokes, his whole aerodigestive tract is exposed to the carcinogens. Okay, so it's not like कि एक बार ये oral cavity हो गया so he saved, अब कुछ नहीं होगा. So that's the same thing कि मतलब development of other malignancy because of the exposure can take place. It's named after Slaughter et al. It's also called as Slaughter hypothesis. Okay, this is important. Please go through it. Now coming to this thing, this is your TOUS, TOUSS. ठीक है? Even see in your every DNB question there will be at least two questions to expand this. ठीक है? In my what exam I gave, area and CV NAT, these were asked. I remember them because I saw it in front of my own eyes. Okay, so these type of questions keeps on coming. और ये एक नंबर का था, ये एक नंबर का था. So that's the, and I'll tell you who realizes the value of this 1 marks na. This is the person who was getting only falling only short by 1 marks. Just ask that guy who is falling short by 1 marks or 2 marks. Okay, so please don't underestimate the value of these things. This again should be a PDF. ठीक है कि अराउंड 25-30 के आसपास एक्रोनियम्स हैं अपने इंपॉर्टेंस के लिए. So please go through it. Okay, TOUS stands for your transoral endoscopic ultrasound surgery. Okay, and when it's used in ENT, it's basically for your supraglottis की malignancy के लिए people are using it. Over here, 2-3 things more you should remember. One is your image of your FK retractor, which is used over here. This is an important instrument का image. ठीक है? Please go through it. Okay, and then there is a ultrasonic scalpel by the name of Thunderbeat. This has been covered under the headings of powered instruments in ENT. In case you have not gone through that, do drop me a message. I'll find it out and send it to you in 24 to 48 hours. Okay, so I'll move on to the next part. Part 1 हो गया, part 2. Now, 36-year-old female with watery discharge from right nostril. Study the scan given below and answer the questions. What is the arrow mark? है क्या? What is the Haddad flap? What is Sternberg canal? Guys, CSF rhinorrhea, when you start your rhinology, CSF rhinorrhea is an important topic. Okay, so you have to go in details about this thing. So I'll just share with you, this is your lateral lamella of your cribriform plate, LLCP. Okay, and what is Haddad flap and Sternberg canal we'll see in the coming slides. So we all know that Haddad flap, please remember the full name. ठीक है? Haddad Basagastagae flap. So how do you harvest it? They ask you how to harvest it. Important. Use. Important. Okay, so this, please go through this slide from Google only. Please see through it. This is basically based on a sphenopalatine artery, and this is important for you. Now coming to this thing, Sternberg canal is in itself is an OSCE. Okay, Sternberg canal in itself is a OSCE. It's also called as, इसका दूसरा नाम होता है lateral craniopharyngeal canal. And how is it found? Basically, it's formed by incomplete fusion of your greater wing of sphenoid to the basis sphenoid. ठीक है, so these are the pertaining images which can be asked to you from lateral LLCP. Please go through it. This is आ रहे भैया अभी आ रहे, ठीक. So this is an important MCQ for you. Okay, now coming to the since the name came, I'll just try to answer like take you down 2 minutes ago. Maxilla, mandible and sphenoid. These are the three bones. You should please go through it. It's important. ठीक है, maxilla and mandible, in fact sphenoid also, all three will be covering in the osteology section. Okay, and please go through the videos of these three things. It is asked types of maxillectomy, cuts of total and medial maxillectomy, and second question is what is the choice of recon flap for maxillectomy. Same questions for mandible also. Types of mandibulectomy, classifications of mandibulectomy, and what is the choice of flap for your mandibulectomy. And sphenoid mein to it's like NCCT PNS mein आधे questions are from your sphenoid region only. So your NCCT PNS, I know you people will be familiar with it, but please go through the last pictorial article करके जो मैंने भेजा था, जिसमें it is 120 pages, but believe me, images के हिसाब से जाओगे तो it won't take 20 minutes for you, but it covers everything about sphenoid, everything about the important NCCT PNS. Please read it, it's important. Okay, there in table viva there is a possibility that in table viva or in the recent advances section, how they place it. I've seen it 2-3 times, so I'll just share it, take 1 minute of yours. They can either place the tables like एक टेबल लगा दी ओटोलॉजी की, एक रेनोलॉजी की, एक हेड एंड नेक की, एंड एक रिसेंट एडवांस की. ठीक है, एंड व्हाट दे विल डू, दे विल प्लेस समथिंग ओवर देयर. ठीक है, और दे विल आस्क यू दैट प्लीज टेल अस व्हाट इज इट, और व्हाट दे कैन डू इज दे कैन प्लेस अ टेबल which contains instrument, which contains CT scan oblique MR scan. Normally CT रखते हैं, MR generally नहीं होता है. I've not seen anybody keeping MRI. Okay, and over in 2 tables they can place something else also. Okay, they can even place some bones. Okay, they may. DNB is a tough exam. It depends upon the place where the exam is being conducted. Okay, so it depends upon their what they have planned for you. So there is a possibility that they'll keep a CT scan over there, है ना. And CT scan में हमसे 2 ही चीज पूछेंगे, NCCT PNS पूछेंगे, HRCT temporal bone पूछेंगे. So please, if you have not gone through, still 1 month is there. You can give 2-3 days of time. Okay, if you want links or videos, please message me. But please remember it. 2-3 videos you'll see 2-3 times. Definitely you'll remember all the important points. Okay, now coming to the next question. Same CSF ranoria का ही है अगला क्वेश्चन. This question is also from CSF ranoria. So identify the device given below. This has been asked before. This is your electronic nose. ठीक है, they might ask you what are the parts. Okay, and now what they are asking is give one difference between CT cystostonography and MR cystostonography. Take a try, somebody. अरे बताओ.
There is no contrast used in MR cystostonography.
I think Pakka, I'll have to check on that. Just a minute. This I'll have to check. Okay. See, jitna, if I am remembering my distant knowledge, the answer should be CT cystostonography is an invasive technique and MR cystostonography is a non-invasive technique. अब बाकी फिर एक बार I'll have to confirm if your contrast thing is there, because ठीक है, मैं एक बार check करता हूँ, है ना. I'll have to check once. Just a minute. I'll note it down. Just a minute. I have to note it down. आपके ग्रुप पे मैसेज करता हूँ तो याद रहेगा. कॉन्ट्रास्ट. ठीक. नो, ठीक है. सो वन थिंग, एक डिफरेंस अगर पूछ रहे हैं तो आप इन्वेजिव नॉन इन्वेजिव, दैट इज डेफिनेटली श्योर. कॉन्ट्रास्ट थिंग आई विल चेक एंड गेट बैक टू यू. ओके, नाउ व्हाट एल्स बायोकेमिकल टेस्ट कैन यू डू. नाउ कैन समबडी टेक अ ट्राई. बायोकेमिकल टेस्ट कौन कौन सा करते हैं इसमें?
Beta 2 transferrin.
Great. Beta 2 transferrin. And there is one more test by the name of beta trace protein. ठीक है, so please remember the details about them. Basically, what are the plus and what are the minus about it. The plus is basically that this is a highly sensitive test. The negative thing is that is it's a costly thing, and transportation time is a problem. Adequate sample collection is a problem, and it is also seen in your aqueous humor and in your liver disease. Okay, now beta trace protein, this basically it is a prostaglandin D2 synthase. This can be asked as a viva. ठीक है, and this is the second most common protein in CSF after your albumin. Okay, but it's also raised in your bacterial meningitis and renal disease. Okay, then after this, what are things they can ask you? This is like they can give you the teapot sign. Okay, that is the reservoir sign. Okay, isko they can share it as a video of a GIF based question also, and they can show a patient who is bending her nose forward and it's dropping. They might ask you what's happening. Okay, then there is a classification by the name of Omaya classification. Please go through it. ठीक है, and management in a nutshell. ठीक है, if they ask you in viva, you should be able to answer it in 1 minute. ठीक है कि सर traumatic में ये करेंगे, spontaneous में ये करेंगे. That's it. Then there is one more thing called as bathroom plug technique. ठीक है, that's for you to read. Now coming to 3-4 things. Now what is specimen? देखो, we all know that this is surgical. अभी point ये है कि बना किससे होता है. So this is made of oxidized cellulose. ठीक है, where do we use it? ठीक है, we all remember कि we use it in neurosurgery procedure में use करते हैं, flaps के ऊपर से raise करते हैं, any bleeding from mastoid oblique chemistry veins, it's used multiple places. Okay, same thing you have to read for Surgicel, Merocil. Merocil किसका बना होता है? What is the made up of? And what is this gel foam made of? ठीक है, uses we all remember. Now few more things left. Please give me 10 minutes more. Okay, now identify this thing. This is an old question, I'll say, not a very new thing. Okay, identify this, name the conditions associated with it. So basically this is a McGovern's nipple. The name of this thing is McGovern's nipple. Okay, where is it used? This is used in choanal atresia. This is an important topic for you. Okay, why is it important? It is important. ठीक है, you have to read. What is the syndrome associated? This is charge syndrome. ठीक है, apart from the routine syndromal जो आपके syndromic hearing loss के syndromes है, there are few syndromes which will be asked from you. This is one of them, charge syndrome. Other will be phase syndrome, PHACE, phase syndrome, which is there in your hemangiomas. Okay, so please remember the full form of both. Okay, now coming to this thing, you can see this if you correlate the image. Okay, can you see what's given over here? Okay, this is the endoscopy image of same thing. Okay, chalo, moving ahead. Now this is your pyriform aperture stenosis. यहाँ से stenosis शुरू हो गया है. ठीक है, this is your pyriform aperture stenosis mentioned over here. Now name this condition. See, this is called as mega incisor. सामने है. Mega incisor. This is the CT of same thing. Where is it seen? It's also seen in pyriform aperture stenosis. Okay, so both of your choanal atresia and pyriform aperture stenosis are important. You will be getting one question on your drug section. Okay, propranolol has been asked multiple number of times before also, repeating the same question. You should know the uses of propranolol in ENT. The uses are basically in your thyroid storm things they use in hemangiomas and all. You can use in vestibular migraine you can use. Okay, dosages you remember. Side effects you know. Side effects are your BP को कम कर देगा, heart rate को कम कर देगा. That is important. Where will you use with caution? In people with bronchial asthma, you should use it with caution. What will you check? You should see ECG and 2D echo वगैरह कराना रहेगा. ठीक है, that's all you can answer for this. Now coming to the next question. Okay, the image is from Scott Brown, 5-year-old child. Comes with this parotid swelling. Okay, given is the MRI scan. What is this? Identify. I'll just enlarge it. Okay, so this is basically a hemangioma, parotid hemangioma. Okay, this is the MR of the same thing. Okay, now what you should remember, this is phase syndrome. Okay, what is phase syndrome? Posterior fossa anomaly, hemangioma, atresia of the choanae, cardiac, eye का problem, and आखिरी में sternal defects आता है. ठीक है, और अगला क्या है? What is this? ठीक है, so this is your navigation and image guided surgery. navigation surgery or your image guided surgery. Okay, so wherever you see these type of images ना, that their registration is being done and साथ में कोई screen है जहाँ पे they are showing multiple coronal sagittal एक साथ दिखा रहे हैं, so the answer is this only. It's user in ENT. This is important. You can answer multiple things. One is your repeated sinus surgeries you can use. Okay, and knowing the facial nerve, knowing the landmarks, all these things you can use. No, 2, 3 boundaries. Please remember it. Frontal recess, very important. Sinus tympani, very important. Prozac space, very important. And आखिरी में facial recess, very important. Please write and practice. ठीक है? This is a habit which we lose after we enter into PG. ठीक है? Please write and practice. उसे लिखना पड़ेगा. If you make mistake, it doesn't matter whether you know or you don't know. The answer is, the importance is whether it's written over there or not. Okay. Now, what is the principle of PET scan? Name 2 radio tracers. And what is functional MRI? Expand bold, BOLD. Okay. So, what are the radio tracers over here? What we remember? One is the 18 FDG, which we remember. The routine one, please see the full form of FDG. It's important. If they ask you more than this, you can answer thymidine. You can answer 11C choline. You can answer FETNIM. All are from your quadrant. PET scan वाले sections उठाया है, ठीक है? Now, what is another question which can come is SUV, ठीक है? What is SUV basically? ठीक है? They can even ask you. There is a calculation-based question which they have started giving to you. So, what is SUV? This is tracer uptake divided by administered activity divided by patient weight multiplied by 1000. Okay, so this is an important point. Please remember it. Now, what is basically the what is the principle of PET scan? So basically, you should remember that radio tracer is injected into the patient. When it decays, so what does it emit? It emits a positron. Okay. Now this positron travels and it goes and collides with the electron. इससे accident हो जाता है. Now when they collide, so they releases the gamma rays. And these gamma rays are detected by the detector which is placed over here. Okay. Next question, identify the device. Okay, so this is basically your images from your Scott Brown. This is your cyber knife. Okay, please remember the image of cyber knife. Please remember the image of your Da Vinci robot. ठीक है, आजकल multiple corporate hospitals have started using it. This can be a possible question. Da Vinci robot. This we saw just now. Okay, SRS का all the questions we saw in the previous one. Pseudo progression we saw, RION we saw. ठीक है, difference between SRS and SRT देख लिया. Okay, moving ahead. So same details of vestibular trauma is very important section. Please go through it. Now, this is now dealing with few questions more. Maximum 5 minutes. Okay, this is a post-uvulopalatal flap. Okay, 3 things you have to remember over here. One will be your UP3 surgery. Full form of UP3 is uvulopalatopharyngeoplasty. UP3. Palatopharyngeoplasty. Okay, these are the incisions you have to remember for this. Okay, uvuloplasty. This is also called as Fairbanks technique. ठीक है, तो OSA में these are questions which can come. One will be your UP3 can come. Second will come is smile. Please remember the full form of smile. Please remember the incision oblique diagram. This is the tongue. They will show some midline incision like this. Okay, they might ask you कि किसके लिए plan कर रहे हैं. ठीक है, so this is important too. Then you should remember about your drug-induced sleep endoscopy. ठीक है, then you should, what scoring is used in drug-induced sleeping endoscopy? This is classified by the Vogt score, probably Vogt classification. And there is a sleep scale which is important for you by the name of Epworth sleepiness scale. Okay, so this is the details given about UP3. Please go through it. Okay, now again coming over here, what is Fairbanks technique? We remember that this is the same UP3 which we saw. Expand smile. This is your submucosal minimally invasive lingual excision. ठीक है, so please remember it. This is important. Now coming to few more things. What is Ebola parotid? This is artificial parathormone. Or that's it. Finally made it. Okay, now Guys, any positive or negative thing or anything which you want to get added, please let me know. Okay, otherwise I'll club all these three PDFs, these two which we read today, and one which I think we read one session back before the mock test which we held. All three I'll include together along with the recordings and share it again. Okay, please go through it, it's important. अब कुछ अपनी तो आपकी तरफ से है तो please let me know. अच्छा, normally we never speak. I also never spoke when I was that side. ठीक है, if anything is there, do drop me a message. ठीक है, we'll try to take care of things. Still 1 month is left, guys. The problem is कि बस वही वहाँ पे you should not get stuck है ना कि यार अब मेरा कुछ नहीं हो सकता. Everything can happen. 1 month is a big time. ठीक है, so just try putting in 3 to 4 hours a day. That is important for you. And as we were doing earlier, COMS Commerce, please dedicate your entire Sundays to COMS Commerce. Okay, and tomorrow I'll just share it again, how to go about COMS Commerce. Okay, few videos that you have to go through, please go through it. Few case presentations, I'll share it with you. And finally on 31st of January, we'll go through once a virtual case presentation. Okay, if anybody volunteers, please let me know. If somebody wants to present a case, I know 99.9% nobody will volunteer. So like मैंने पिछली बार किया था, I'll only present a case. Okay, and I'll keep on discussing whatever questions can be asked to you in the same presentation only. Okay, and what can be the possible answers. Okay, now since I'll just tell you that the people who have been joining late, okay, I will be telling you the questions कि ये पढ़ना है, please go through it. Okay, if you find any difficulty, you get stuck somewhere, please get back to me. Okay, it's not that कि I'm just कि हाँ बस सब पढ़ लो. I'm not the guy who will always say कि बस जाके पूरा Scott Brown पढ़ लो. ठीक है, it's not humanly possible. But there are few important things which I've seen questions coming from that section, so that's why I say. And it's not that कि questions will be repeated. That's a wrong notion. But that topic will definitely gonna be repeated. AFRS is gonna be repeated. I'm not saying वही question आएगा, but AFRS से question आएगा. Okay. So CSF Renoria we saw everything in detail. Okay. GNA we saw in detail. Base of skill we saw in detail. So इस तरीके से तो keep on revising the topics which have already come in exam along with the routine study which you go 3 to 4 hours a day should suffice it. ठीक है, it's not important to study 20 hours a day. It's not possible. It's not important. Your mind will go for a ride. ठीक है, take good care of your health, and that is only possible when you study for a limited time. But that study should be of quality. अच्छे से पढ़ना है. चलो, all the best. Too much of ज्ञान for the day. All the best. Have dinner. Good night. Bye.